Hello, this is Matt Starr with Starr Wellness Coaching. I'm a wellness coach who works with people one-on-one around issues connected to hepatitis C and liver disease. And if you're watching this video, you operate a health clinic of some type, or you work in the healing profession as an acupuncturist, a naturopath, an energy healer, a variety of other possibilities. Um, so I so much appreciate the work that you offer to people and to the world. I've found a great connections with a clinic near my home, Sojourn's Medical Clinic in Westminster, Vermont. And the help that I've received from them has been really crucial in my return to health after spiraling down and down and down into what seemed like endless darkness. Um, and at one point, when things hit really rock bottom, um, I decided I needed to do something different, something more, and was able to crawl back up and found myself at the clinic and found myself in the capable hands of some wonderful, caring people, much like yourselves. Um, so now I see the one connection between my hospital care, which I do appreciate. I have a wonderful gastroenterologist, but the connection between that hospital setting and your clinics, at least from my experience, is that there's still a limitation on the amount of time that can be spent with an individual patient. So you all offer, by and large, the idea of looking at the whole parts of the body rather than separate parts, how systems interact and work together, how the mind influences the body and healing, mind-body medicine, um, and a host of other things that I find really valuable. I now receive acupuncture, as I mentioned, and also take IV infusions consistently that involve high doses of vitamin C and glutathione and other homeopathic meds to support my liver. My diet is very plant-based, so that foods that are good for my liver are the foods that go into my body. I have a deep yoga and meditation practice that has really grown since I've stepped out of the hardest times of my illness. So that's a real peaceful, meditative um, approach that I find healing in. I'm able now to do a lot of the vigorous activities that I once did as an endurance athlete before all this stuff started happening to me. I swim, a mile, mile and a half most days, take little runs, little bike rides. So work on my garden, big garden, and volunteer on the farm here where I live. And so anyway, there's a lot going on for me. My life is back on track. I feel great. I have normal energy. And I want to help other people do the same thing. So the work that you all do is so crucial and so important. I think I can offer that with the amount of time spent with people that gives them the support and the accountability to a sort of healing plan that they buy into, so that they are, doing their work, and being consistent. And so I'll hold them to the plan that we come up together. I'll listen to their story. I'll tell them mine. We'll see where those two stories interface. If there's some kind of thread or a connection that they feel from my story towards theirs, then we can use that. It's not meant to intimidate them because of how well I'm doing, but only to let them know that there's hope and that we can get somewhere different than where they are now, regardless of where they are now, and regardless of what that difference is. That we can accept and be grateful and be appreciative of the life that we live and the world that we live in and the people that we're surrounded with. And from that place of appreciation and gratitude, the healing process, at whatever stage it takes, can begin. So, if you're comfortable with my work and you know of me, or you'd like to know more about me, you've seen my website, you've seen my writings, you've seen the letter that came to your clinic, I'd love it if I could help you help people. If you take my business card, put it in people's hands and say, here's somebody who's doing one-on-one work with people. If you're interested, give him a call. Um, I think that would be a great benefit to them. It would only augment the work that you do. So that's it. Thank you so much for doing the work you do. And I hope we have a chance to connect in person. And I appreciate you reaching me and saying, yeah, you'd like to have my business card and you'd like to put that in people's hands in your clinic when you run across people with Hep C or liver disease. Okay? Thank you very much. Take care. Have a beautiful day. Blessings.